Good morning. I am Anusha. As a nursing tutor at Emmanuel Arasa College of Nursing, I am going to present a topic as epididymitis. Definition: epididymitis is an inflammatory process that occurs in the epididymis. It's infection and inflammation of the epididymis. The epididymis is a structure that forms a curve that attaches behind the testes and is made as a storage place for mature sperm. Classification is divided into two types. Is based on the onset of pain. Epididymitis can be divided to two types. So acute and chronic. Is acute, it will be present in the short durations. Is the pain and swelling in the just a few days while on. But chronic epididymitis, it will be presence of pain is more than 6 weeks and a recurrent episode of pain will be present. So the onset of pain and the inflammation in the epididymitis can be lost for at least 6 weeks is accompanied by the emergence of induration in the scrotum. Epidemiology is commonly present in the men of various ages between 19 to 35 years. Etiology is based on the depending on the age and behavior. So epididymitis is etiology will be present. Sexually transmitted diseases. Infection is a non-sexual bacterial. Amiodarans, urine in the epididymis. Trauma due to the thigh injury. Tuberculosis infection. Toes and testes. Behcet's disease. The most common children parents with E. coli, ureaplasma and ureolithicum. Risk factors: having sex with a sexually transmitted disease, suffering without using condoms, have a history of sexually transmitted infection, have a performed medical procedure that affect the urinary tract, has prostate enlargement, have been infected with the prostate infection or urinary tract infection, uncircumcised men, abnormal anatomic location of the urinary tract, urine catheter for the long term, tuberculosis, amiodarans medication. Pathogenesis: the inflammation is thought to originated from the bacteria that are in the bladder, prostate or urethra, which ascending into the epididymis. Can also occur urine reflux through the ejaculatory duct or hematogenous spread of bacteria or directly to epididymitis as in the spread of tuberculosis bacteria. Clinical manifestation: epididymis is painful and swollen, fever, goosebumps, urinating frequency and always feeling incomplete and painful, discharge from the penis, testicular pain, sex hurts, blood in semen, scrotum will swell, feel warm and pain when touched, lumps appear around the testes, is caused by the fluid build-up, discomfort or pain in the lower abdomen or around the pelvis, enlarged lymph nodes in the groins. Diagnosis: to find out the cause of epididymitis, the doctor will recommend several types of tests such as fluid sample test, blood and urine test, digital rectal examination, ultrasound. Treatment: the treatment of epididymitis aim to treat infections and relieve symptoms that arise. One way is by administering drugs such as antibiotics. Examples of antibiotics like doxycycline and ciprofloxacin. Pain reliever is brufen or paracetamol. In patient is under 35-year-old with germs that cause chlamydia or Neisseria gonorrhoeae. The selected antibiotic is amoxicillin should be administered or ceftriaxone can be given as intravenously. So the proceed with the administration of doxycycline or erythromycin orally for 10 days. Patient can make an independent effort at home to help relieve the symptoms of epididymitis, among them by lying in bed for at least 2 days with the scrotal position raised. Raise the scrotum. Compress the scrotum with cold water. Avoid lifting heavy loads. Avoid sexual relation with the other people to prevent the spread of infection. Surgical procedure, if in case of epididymitis is not successfully treated with drugs, the doctor will recommend surgery. The procedure can be done if pus has arisen in the epididymis. In other more several cases, the patient must undergo epididymectomy or surgical removal of epididymal canal. Complication: abscess in the scrotum, infertility, tear of the scrotal skin layer, death of testicular tissue due to the lack of blood. Thank you.